All right, in this video, I just wanted to go over a quick orientation of PCC. In the subsequent videos, we'll be going over each of these tabs and what they do. We'll dive a little bit deeper into the big things like orders, assessments, progress notes. But this video is just to get you familiar with the PCC clinical chart. So this is what I call the clinical chart. This is where you can see orders, put in your assessments, make progress notes. The other area that you'll be spending a lot of your time is the EMAR. And we will create a video for this separately, but it'll send you to a new link. And then this is where you can select the MARs and the TARs. And this is where you'll do most of your daily charting here. It's point click care because it is pointing and clicking. So you come here, click into a residence chart, and you are literally going to be saying, yes, I administered, or no, I did not. And it will ask you why. Simple as that. So then coming back to the clinical chart, you can see you've got their name. You have a lot of their vitals here. You have, this will say their location when they are actually in a room. Some quick demographics. And then you can click this box and this will expand and tell you their diet and their diagnosis and their code status if I had put the code status in. The care profile, this is where you can come and write special instructions. For example, we have takes pills whole here. So that's a helpful tip for some people. You can also come here and select any of these things that they may be using. This isn't something we use too often here at Alpine, but it is helpful to know. You can come and edit their demographics here, which may actually not be allowed on a standard nursing PCC access. So then you can come and print different things from their chart. So in this grid box, I didn't mention allergies, but you'll also see allergies. So then going down is just these tabs, just going all the way down these tabs. So I'll walk you through what these tabs are. Dashboard is just a quick overview of them. It goes over unreviewed lab results, order alerts, administered PR, unadministered and administered PRN medications, and any clinical alerts such as bowel movement, vitals, out of range, and things like that. The profile, this is where you can find family members. This is where you can find doctors and external facilities. So if they had a fall or if there's an emergency, you can come here, find this number, see their contact, and call them. The next one is your census line. So this will tell you who their payer type is, if they're on a Medicaid stay or a Medicare stay, or if they're private pay, if they have an HMO. A lot of technical details here. This isn't something you have to worry about too much. I would say the most important thing here is primary payer. This will just help you understand Medicare or Medicaid. Those are going to be our primary payers here. Medical diagnosis. This will be any diagnoses that we have for these people. So you can create new diagnoses, but typically if you're going to create one, just be very careful. Maybe consult with the MDS nurse to make sure that that's okay. But you can see their diagnoses here. You can also see the principal and secondary diagnoses. Coming over to the next tab, allergies. This is where you can see allergies. You can add new allergies here. Immunizations. You can see any of the immunizations they've received. You can add new ones here. Orders. This is a big tab. So this is where you'll see a lot of your orders that they have. Something I find helpful is Control F. That will pop up a search bar here, and it's super helpful if you're trying to find specific things like oxygen if they have it. Okay, so now I know this person doesn't have oxygen. How about what's their diet? Do they have a diet? Oh, look, okay. So we found a diet order here, so now I can come here and see. You can also see the category. If you click it, you can sort by any of these things. So click once, it goes alphabetically. Click twice, and pharmacy, all the meds will pop up at the top. Some other things you can do here, you can expand these to see who created the orders and just some quick details about them. administration, the diagnosis, some helpful things without actually having to get into the medication, click view, or anything like that. Weights and vitals, this will be where you can see any of their weights and vitals, obviously. You can see here, every month this will reset, so all of these will appear blank, but you can also click any one of these vitals and it'll give you a trend. This guy only has one vital in, so on a normal resident, what'll happen is you'll see a bar graph, or a line graph, excuse me. And then you can come here and see a history of all of their vitals. You can also add any new vitals that you want here as you get them during the shift. Results, this will be where you see blood work. You can also see lab results, and then radiology diagnostic results here. The MDS tab is not something you'll have to spend too much time in or worry about right now. Assessments, this will be where you do your assessments. So we'll dive into assessments in another video, but there's a lot of cool sorting features, and then you can start your own assessments here. Therapy is something that the therapist will use. You don't have to worry about this tab. Progress notes is another big one for nurses. So come click new. This is where you will create new progress notes. And then you can also view old progress notes here. Or by clicking view all, you can go back really far. The care plan will just be, it's basically a story about the resident. It says all of their issues, some of their goals related to those issues, and our interventions. For example, a fall. They're at risk for falls. Our goal is that they don't fall. And some of our interventions are, say we have a fall mat in place, or we make sure we bring them out to the dining room. We have a sign in place in their room that says, call, don't fall, things like that. Tasks is helpful, where you can see the CNA charting here. You just click this question mark and it'll pop that up. And then documents is for anything else that is uploaded. For example, if they go to a specialist, if the podiatrist comes here and we get office notes, those things will be uploaded here. Oftentimes, old doctor's notes are in here. Special forms that they've signed will be in here. A lot of miscellaneous things. This is another place I like to use the Control F feature for. And that just about sums it up.